Ted Owens with the Tahoe Forest Health System, and welcome to Mountain Health Today. Our guest today is going to be the Chief Financial Officer of the health system, Crystal Betts, and we'll be back in just a moment. Welcome to Mountain Health Today. My name is Ted Owens, your host. This is a program produced by the Tahoe Forest Health System about community health and all things healthcare related. We hit different topics with each episode, and today our guest is the Chief Financial Officer of the health system, Crystal Betts. Crystal, welcome, and thank you for spending time with us today. Today we're going to talk about a financial customer service program that you built, but before we do, let's talk a little about the Tahoe Forest Health System and the trajectory it's been on over the past dozen years in terms of quality.
Well, I've been with the health system for about 15 years. However, I think this journey really started a year prior to my coming. The focus was on quality of care. It was focused on patient safety. It was focused on really that patient satisfaction connected to the care piece of our health system. And we've done tremendous work to really elevate our game in all those categories over the last several years.
Tell me a little bit about what that entailed, the journey to get there. It wasn't something that you flipped a switch on. There was a lot of work that went into it. Can you share?
There was a lot of work done by several members of our team. Obviously, the clinical sector of our health system was critical in bringing up the quality of our care, the focus on our patient safety. We've made huge investments in our technology. We've made investments in our buildings themselves, and we've even invested in software to really help us focus on the clinical care and the patient safety aspect. We recently went live on a system called Epic. That was November of 2017, and it's just greatly enhanced our ability to be really safe with our patients. So it took all characters, all playing a part to really elevate our game. We focused on Baldridge and some other kind of avenues that could help guide us to being a high-performing. And so that was super critical for us to elevate our game.
Let's talk about the physical plant for just a moment.
Sure.
Tahoe Forest Health System is a district based in California, in Truckee. So you had some tools that were available to you as a government agency.
That's correct.
And in constructing your campus, of course, you had regulations you had to meet, but it also gave the opportunity to create state-of-the-art interiors and spaces to practice, correct?
That's correct. We are very thankful that our community within our district boundaries passed what we called Measure C, which was a general obligation bond for $98.5 million. It allowed us to really create a lot of building construction projects to bring ourselves not only seismically safe, but also to enhance the patient care, patient safety, and investment in technology. So thank you to our community for passing Measure C. That was super critical for our future.
And tell me, the projects were constructed over about a 7-year period of time, and did it come in on target?
It did, which is unusual, so we're very proud of that.
Very good. And so, as a CFO, I'd imagine you had a few sleepless nights on that journey.
I just was hoping that construction team would manage the projects to my expectations, which they absolutely did.
Very good. So did that enhance the number of services, not just the quality of the services that existed before, but say the number of services offered?
Absolutely. So it helped us elevate our emergency department. It built our new cancer center, which is very noticeable from Donner Pass Road. Those were two very significant projects that we invested in. We did a lot of other things with the project as well, but those were definitely two that we heard loud and clear from our community that they wanted to invest those dollars in.
And of course, up here in the Lake Tahoe area, the same is true with Barton and South Lake. our communities have grown tremendously and changed. And so are there different demands on the health system than, say, 15 years ago?
Oh, definitely. There is a high expectation to be able to access care, know the type of care they're receiving, wanting information ahead of time, using technology. People don't necessarily want to make a phone call anymore. They want to get online. They want to look at their information that way. They want text messages. They want to be more involved in their healthcare than they ever have before.
And use of technology is important. I mean, I just got dial-up at my house, and it's working wonderfully. But
got a ways to go.
I have a ways to go. That's true. You had mentioned the EMR system. What is that for folks at home so they understand how important it is?
So it's an electronic medical record or electronic health record are the two names you might hear it by. It's a way to contain all your documentation of what's happening with your care. If you happen to go to another facility, that facility can access your record with permission to see what might have happened at our health system if you went to somewhere like UC Davis or another system that might utilize Epic. So it provides a great deal of continuity of care. It's the top product out there right now.
So a little later in the program, we're going to talk about what that means in terms of your world more specifically. But before we do, this is something, was it driven by the ACA, the Obamacare? Did it emanate out of that?
Partially. So the system we were on for a number of years, we knew wasn't a real high quality product for where we were going as a health system. There was also something called meaningful use that we had to adhere to as part of the ACA. And the system that we were on wasn't going to get us to the next level of meaningful use. And so we were going to have to make a switch no matter what. But our Chief Information Officer, Jake Dorst, was really good at identifying possibilities for our health system and found a way to make Epic affordable for Tahoe Forest, where usually it's $1 billion investment for a larger health system.
I would imagine affordable might have a different definition for you than the rest of us as the CFO.
Yes, absolutely.
We're going to be back in just a moment. I'm Ted Owens. This is Mountain Health Today. Our guest is Crystal Betts, TFHS CFO. We'll be right back. Welcome back to Mountain Health Today. I'm Ted Owens, and our guest is Crystal Betts, Chief Financial Officer for the Tahoe Forest Health System. Crystal, where we left off just a moment ago, we were talking about the electronic medical record system. Now let's get into your world, because excellent care, which we spoke of, and high quality care is very well and good. But one of the problems, I think, nationally is on the back end. It's when the bills start coming in. And that presents a problem really in your world.
Absolutely.
Why don't you share with us what those problems are?
Well, first of all, our national health system has made it very difficult to bill and collect for healthcare services. One, the rules, the regulation, the technology, the construction, the various regulatory agencies that we have to deal with, the multiple health plans that we have to figure out how to bill, how they want to see the claim.
So I want to go back to that. Everybody's health insurance is different.
Yes. Whether it can be a government plan, Medicare, Medicaid, Medi-Cal in California, or versus insurance plan, Blue Cross, Blue Shield, Anthem. There's just a variety of different plans. They all have their own manuals. They all have different rules. Do they, like for example, on a mom and baby, do they want the claim combined? Do they want the mom on one bill and the baby on another bill? What if the baby stays longer? What if the mom stays longer? What rules do we need to follow to make sure we produce the claim that payer will accept? And that gets very challenging.
And then also providers, doctors.
Yes.
California has, for 80 years, I think, had the corporate practice of medicine. So doctors are not directly employed by the hospital, so their bills drop differently. Isn't that
Well, you have your professional fee, the physician, and then you have your facility fee or technical fee, which is more of the hospital. And so you have two types of bills. A professional bill usually goes on what's called a 1500 form, and the hospital bill usually goes on what's called a UB form. And most of the time, that's the cardinal rule, unless you happen to be like a critical access hospital that opts for a different billing methodology for Medicare, and that suddenly squishes stuff together and makes it highly complex. So that's where our EMR system really needs to play a critical part in how we built it. So the build has to follow the billing rules for the type of structure we are, whether it's a professional bill or a facility bill.
Now, you understand this very, very well. The end user does not always understand that, and
Absolutely
it's very complicated. So the problems that you've run in through when you were fielding phone calls from people, what kinds of questions do they ask?
So usually it's after the fact, they got their bill, maybe their insurance didn't pay as much as they thought it was, maybe they didn't pay anything at all, maybe their out-of-pocket's too high and they want to know if they can have a payment plan, maybe their insurance denied part of their bill and they want to know why. They might have had an insurance change and they want to know how can they give us their new insurance information and have their bill resubmitted. Sometimes it's, wow, this costs a lot more than I thought it was going to be. How come?
So isn't it true that that kind of places your shop as the tip of the spear? They don't know who to call, but they know to call you. And so you're representing all kinds of things that are not necessarily within your sphere of control, correct?
Yeah. So actually, I think that's a failure of many healthcare systems is patients not knowing who to call. So if they went and saw their doctor and they had a question on their doctor bill, do I call the doctor's office? Who do I call? And we see that a lot too, is they think they called the right number and then they get passed around and in the end never get the answer they're looking for. So sometimes that can be a very significant point of frustration as well, is knowing or not knowing who to call.
So before we leave today, you set forth, you saw a problem. You're in a rural environment. Mm-hmm. You decided you were going to do something about it. I think we're going to have you back and we're going to talk about that more in depth. But what did you think was needed to help solve some of this?
You know, our patients, their family members, our consumers of healthcare deserve the same amount of focus on this side of healthcare as the focus we had on the quality of care and the patient safety and that satisfaction piece. And we as a health system probably weren't doing as good of a job as we could have been doing, and I think that's a problem nationwide, and we wanted to find a way to make this better for our community. And so my team pulled a plan together. We didn't steal this from anyone else. We took the comments we got directly from our own patients and community and tried to build a program to address their needs.
Okay, and I think that's fascinating, and we're going to share that in another program. I want to learn a lot more about that and how you played architect and designed a program.
Sure.
But Crystal, thank you very much for joining us today and being here. And thank you for joining us on Mountain Health Today. I'm Ted Owens, your host, and we'll see you soon. And welcome back to Mountain Health Today. My guest is Crystal Betts, CFO for the Tahoe Forest Health System, and we're talking about your recognition of the needs of the public on the back end of healthcare, which is the billing part, the insurance part, the complicated part. A moment ago, Crystal, you shared with us all the things that you recognized that the public was seeking, and you said about developing a methodology of addressing that. No one else had done it. You didn't steal it, so tell me, where did you start?
So we took our information that we had been gathering over the years of the frustrations, the complaints, and really tried to categorize each of these segments to figure out how best could we address this. And we knew we needed to address it from the front line, not just behind the scenes. So when patients try to access us, we need to be more proactive on the front end. But we also knew there were things we needed to be able to take care of on the back end. So we wanted to create two focal points for our patients and our customers, which is kind of that one number to call for whatever question they may have. We also wanted to make sure that our patient registration and scheduling folks had tools to use on the front end that hopefully diminish the number of questions and complaints on the back end. So I brought together our Director of Patient Registration, Crystal Jefferson, and our Director of Patient Access, Debbie Stanley. And the two of them sat down with staff and kind of outlined the structure of the program we wanted to put together.
And that's on the front end or the back?
A little of both.
Okay.
So with both of them being in charge of the front end of the process for patient registration and scheduling and those sorts of things, they were able to take and kind of guide their existing staff to make some changes. They also created the structure on the back end for when people have questions after the fact.
Now, did you have staff in place
No.
to handle this? So,
No. We
so
had
you had
a
to bring
few.
people in, so there
Right.
was a commitment of the organization. And are these people readily available, or did you have to design the work for them?
So we designed the job descriptions, we designed the expectations that we had of these individuals. We wanted to make sure they were well-rounded in their knowledge to be able to field a variety of questions. We had some existing financial counselors, but we knew we would need an additional one and a supervisor to create that pocket of team members. We also needed financial customer service representatives, which are the people you usually connect to on that first phone call when you make to our financial customer service.
Was there any specialized training that
Yes.
was required of these folks?
So we started with the job descriptions. Both positions, the financial counselor and the customer service rep, require certifications within a certain time period. We go through it's a program we use that has certifications available, and it's a certain number of education classes and a test that they have to pass to get their certification. So it's not easy.
And then also it's important to have people that have good phone skills or that are personable, correct?
Right. So we required them to go through customer service training and go through 10 modules. We required them to know how to use the phone system. They had to understand billing. They had to understand health insurance plans, how to register, how to schedule, how to get authorizations. They had to understand how our financial assistant policies worked, how to help people with payment plans. So it required at least 4 to 6 weeks of hardcore training before we would allow them to actually go live and help someone.
And you went live, I believe you had a soft launch in the fall of last year?
So we started this program around July, and we didn't kick it off until the very tail end of October. October 30th was our soft launch.
You want to make sure everything works.
We did it softly because we wanted to make sure we could work out whatever bugs might creep up, and then we were ready to go out to the public with this program in January. So we took a couple months to kind of get our bearings.
So you've been flying with it for a while. What kind of feedback are you getting?
Awesome. The feedback has been very, very good. We've fielded, as of the end of February, almost 8,000 phone calls, and we have what's called an abandon rate, which means the person hangs up for some reason, and right now that's only about 3% of our overall phone calls.
But that's their choice.
It's either they don't want to wait,
want it,
or they've found out they had the wrong phone number, whatever variety of reason they hung up.
Okay.
Our time to answer those phone calls averages about 28 seconds, so hopefully it's not because of hold times. And then we like to finish off the call with a customer service survey where we ask you to rate us on a question, how well was your service between 1 and 9, so we can measure how we're doing.
And to be clear, I think you said earlier, you try to do this in one call. So
Yes.
you keep them on the phone
Till it's resolved.
Until it's resolved.
The goal is one phone call for that patient. And even if the customer service rep cannot fully complete it, but there's someone else who can, we do a warm handoff. The last thing we want to do is transfer you cold and not know if the person on the other end picked up to help you with your issue.
And those handoffs might occur internally, or they might occur with their insurance company, for
That's correct.
example. And so there's a facilitation that goes on with your folks?
Yes, because a lot of the time it may be an insurance issue, even though the patient might think it's our issue, we did something wrong. It's actually we have to deal with their insurance company. And so instead of just saying, hey, you got to call your insurance company, we try to make that phone call with you, because you may not know what to ask, what to say, what was wrong, where we do. And instead of putting you right in the middle, we want to facilitate through and get it resolved with you.
Well, it sounds like it's been running very well. Have you trademarked your concept so that it's unique to you since you built it?
No.
No?
And
Okay.
I definitely want to say the credit goes to my directors and my staff, not with me. I was there to support, guide, get feedback, to have our senior leadership team support it, our board members support it, but they did a lot of the hard work.
Crystal, thank you very much for being here today.
Thank you.
And thank you for watching Mountain Health Today. I'm Ted Owens. We'll see you soon.